Hello, everyone. I am Courtney Boone. I am the current president of NAMI Coastal Virginia, and welcome to this evening's program. Welcome all of our affiliate members and actually those from beyond our community, thanks to the beauty of our virtual world, or the virtual world we're living in. Before I introduce Jenny Brown, our guest this evening, I want to thank you so much for all of the questions that were submitted. They were very good. And in light of the time period that we have Jenny and her expertise here, what we have done is we took those questions, if they're not going to be answered this evening, and in the program we're going to have in March, and then the following program in April, those will be answered. Caveat to that, if you do need an answer to one of those questions in a faster fashion, please do not hesitate to call our office, and we will absolutely help you and get you linked up with those answers you're looking for. So thank you very much for submitting those. I have the honor of introducing Jennifer Brown. Jenny is duly certified psychiatric nurse practitioner and clinical nurse specialist. She received her bachelor's, her master's, her postmaster's from University of Virginia, and a doctorate in behavioral health services. Sorry about that. Health services research from Virginia Commonwealth University up in Richmond. She holds an appointment as consulting faculty in the School of Nursing at Duke University, and Jenny is practices and is the owner of Seaside Behavioral Health. Thank you in advance, Jenny, for lending us your expertise and answering these questions that were submitted.
Absolutely.
We're going to jump right in and get started. So one of the first questions, and we're going to put these in sections in regard to mental illness, is from one of our participants: how does mental illness come about? What are the triggers? What are different types of mental illness?
Okay, so I thought I would be as much of an overview of this as possible, because I imagine that a lot of you, this is something that you're well aware of. But so, there are basic biological, psychological, and environmental factors that can all come into play that will contribute to the possibility of a mental illness. And so when we think of a mental illness or a mental condition in general, they're conditions that affect either or a mood, thought, and behavior. Okay. And so when you think of biological factors, for the most part, we're talking about potential chemical imbalances, which could be something that's inherited, or it can also be something that biologically could cause prior to somebody's birth, which could be from a condition that occurred in the mother, where if she'd been exposed to some sort of infection or had some sort of exposure to a toxin, also substance abuse type situations in the mother when she was pregnant. Those things could contribute to later on any sort of illness. Then in terms of environmental factors that can contribute to mental conditions, you think about substance abuse, again, exposures to toxins early on in life, any sort of types of brain injuries, and then psychological factors would be trauma, stress, earlier, later in life. And so in terms of how all of those affect what types of illnesses we talk about as mental illness, you think generally of the 5 different groups. We've got our mood disorders, which would be depression, bipolar disorder, and anything that's kind of within those realms, dysthymia, cyclothymia. Then we've got our psychotic disorders, schizophrenia, schizoaffective disorder fall along there, any sort of brief psychoses. Then you've got your substance abuse disorders, your anxiety disorders, and eating disorders. Okay, and then kind of actually be a sixth category are cognitive disorders. So that would be like dementia and amnesic disorders. So in terms of so that kind of gives you the causes for them, as well as what types of disorders we're talking about. But you know, one of the other questions that was asked in there is when we think about how those factors come into play, are those conditions inherited? And if somebody had asked the question, if I have bipolar disorder, am I going to give it to my child? And so that's an interesting question. That yes, in fact, that some mental illnesses are more predisposed or inherited than others. And for example, like when you think of post-traumatic stress disorder, obsessive compulsive disorder, and major depressive disorder, those particular ones are inherited about 20 to 45%, whereas when you're talking about schizophrenia and bipolar disorder, it's up all the way upwards to 40 to 45%, which sounds very, very alarming. Actually, sorry, not 45%, but rather 75%. But that sounds very alarming as a statistic. But what you're actually talking about is, so those illnesses, the presence of bipolar disorder in the general population is 1%, or 1 in 100 people will have or suffer from bipolar disorder. If one parent has bipolar disorder, then your risk goes from 1 in 100 to 6 in 100. If both parents have it, then your increase of your risk goes from the 6 in 100 or 6% to a risk of 40 in 100. So you've gone from 6% with one parent to 40% if both parents, and that's where it's kind of jumping. If a sibling has it, it's 13 in 100 or 13% in terms of your risk factors. So I think it's a little misleading when people think of inheritability and will make some statements of, I don't want to have a child because I'm afraid I'm going to pass it on. I'm going to pass this illness on. And a lot of times we have to talk to individuals who suffer from various mental illnesses to help them to understand that it's not, the statistics are not that simple.
Okay. Well, thank you for that. The other question that did come up was, are there ways of preventing developing a mental illness?
So when you go back to looking at the various types of risk factors, and you're talking about the biologic and the psychologic and the environmental, well, so we can't really affect our genetics, but we most definitely can have some mitigating components to reducing our risk for both the psychological and for the environmental factors. And that being said, you know, certainly if you are reducing the stress in your environment, if you are eating healthy, trying to maintain a healthy lifestyle in terms of your environment, reducing environmental toxins and exercise, if you are making sure and trying to minimize or eliminate any alcohol and drug use, those sorts of things can certainly reduce the potential that you're going to trigger a mental illness.
Okay. And you did sort of just touch on this, that another question was in regards to do drug utilization cause mental illness?
And so I think it's important to realize that there are plenty of people that use drugs that don't become mentally ill, and there are plenty of people who become mentally ill who don't use drugs. So it's realizing that it's not one that causes the other or vice versa, but rather that drug use is most definitely a risk factor that can certainly exacerbate or trigger mental illness when there are other factors in combination.
Okay. Then it goes to, I guess, can it be cured? Can mental illness be cured? Mm-hmm. And we do hear that a lot when we get calls from parents who have their son or daughter just recently was diagnosed. That is absolutely something, and they're nervous to ask it.
Right. So, my answer to that when I have individuals that ask that, I think it's important to realize that although we don't really talk about it in terms of cure, I think it's important to realize that certainly symptoms can be reduced to the point or eliminated to the point that there is complete recovery at times if an individual's mental illness was situationally induced or episodic, that there are times where treatment can be completely removed and there are no symptoms. There are other illnesses that are more pervasive that have either, as I spoke to before, that component of chemical imbalance. And when there is the component of the chemical imbalance, and a lot of times when we're talking about the serious mental conditions, there are changes in brain chemicals and the way that the neurotransmitters are working and receiving, as well as structural changes in the brain. And so for those particular conditions, it is often necessary to continue with some level of maintenance treatment long-term to keep the symptoms at bay. And so it may be that staying on the medication is exactly what is necessary to have no symptoms. And that's a hard thing to help individuals understand, is that sure, you have no symptoms right now and you are on medication. We can make that decision as a team, provider, family member, and patient, that you want to test the waters and see what it's like without your medication. But one of the things that I have to talk to individuals about is there is the risk that when if they have a serious condition, that when you go off medication, that the illness, it may come back in a month, it may come back in 6 months, it may come back in a couple years. And each time that you have another episode of a psychosis or a manic episode or a severe depression, it causes additional neuronal injury that is significant enough to take note. You don't want to keep repeating that cycle. And so when somebody's had one episode or serious episode of illness, I let them know it is up to the individual to decide once they've reached a period of stability, if they want to taper and get all the way and see what it's like without medication, if they then have another serious episode of illness, they have to understand that now their risk factor has gone from 50% to up to 75% likelihood that they're going to have another or recurrent type episodic illness.
When you're with your patients, do you highly advocate for that not to happen, or do you absolutely leave that decision to the patient and to their family members, if that's applicable?
I find it very much a conversation that we have together. And I will say, because I feel it's much more empowering for individuals to make that decision to reach that decision themselves. So I would say that and that's my perspective. Certainly, there's going to be other providers that have a different approach. For me, I feel that it's important to inform and let them know the likelihood or the possibility that a relapse could occur, and we discuss the potential signs and symptoms of what that would be, so that the sooner they could potentially reach out and do something earlier, and not let it get to a significant, kind of decompensation, the better, that we could get back on medications sooner. But I think it's pretty important for individuals to feel that they can reach a recovery and then make their decision of where they go with that. And it does tend to bring people back into treatment when they need it, rather than feeling like mental health treatment is not where they want to go and that they're going to turn anywhere but that.
That's a great comment you just made. We're going to transition a little bit right now over to children, adolescent, our youth's health. This is a caveat that for many of you, if the questions you asked, because there were some specifics, aren't answered, we do have a children's challenging behavior class, which you can find on our website, as well as other youth programming like Ending the Silence, which is actually tomorrow evening. So Jenny, you're a parent and you're looking at your child. Could you go over some of the signs that a child might be exhibiting if they have a mental illness or beginning to develop?
So when you're looking at children, you want to be aware that it's, children's behavior can certainly be, erratic at times, but it's that you would actually see more excessive emotionality. And so you're looking for a extended period where or more excessive. And when I say that, so kids can be hyper, but that the hyperactivity would be interrupting school, such that the teachers are reporting that it's a problem with other students. Kids can have temper tantrums, but that the frequency of the particular child, your child's temper tantrums, are more significant versus seeing other children, or the way that the excessive behavior during the temper tantrums are getting to the point that it's really worrisome that they're going to hurt themselves or damaging things, that the child may worry, and the worry is getting to the point that it's upsetting the child's appetite or sleep for a persistent period of time. Outbursts and aggression towards the family pet or towards siblings. also nightmares, but that the nightmares would be frequent. Those are some of the symptoms, and then certainly changes in school performance. When you're talking about children, and then with teens, I think we'll get into in a minute, but those would be the things that we're really looking out for in children.
Okay, thank you for that. On to teenagers, and this couldn't be more applicable today. What are some of the indicators that a teenager is in distress? Does that differ? I'll give them both. Does that differ between the male and the female? And then, is there a big difference between the teenager and the adult?
So a lot of the things that you'll see in teenagers are also some of the same types of things that happen in adults, but you have to look at it in terms of context. That first of all, they haven't fully developed in terms of their emotional maturity and even how to seek out help. So or even stability in terms of their peer group. So their comfort level in asking for help, as well as their own self-concept to feel confused, to not know what's going on in their own body, and not feel comfortable talking sometimes to peers or to adults about it. Just an overall level of confusion is different for the teenager versus the adult. That's where I would say there's some difference. From males and females, the difference, I think, most significantly that you might see is that females do tend to experience some of the hormonal changes earlier than males. They just tend, and that's going to vary with the individual, but we do know that that females do tend to start in terms of their puberty earlier than males. So one of the things that you may notice, one of the questions a little later on was, how do we distinguish the difference between what is just puberty and adolescent kind of emotionality versus something that is more concerning in terms of a potential disorder. But what I would say is that sometimes the two go hand in hand, because the change in hormones may actually be what is contributing to the actual emotions and changes and causing anxiety or causing the depressions or the mood swings. And so the point I would make on that is that you may start seeing that at an earlier age in females than males. Females do tend to have a higher rate of anxiety and mood issues, also with some self-harm. You also tend to see more issues with eating disorders in female teens than males. On the other side of things, when you're looking at substance abuse as the means, substance abuse and acting out anger outbursts and volatility, that's going to be more along what you're going to see in terms of males versus females. So I think that the manner in which kids act out might be slightly different, but the kinds of things that you'll ask about or try to assess in your mind when you're figuring out whether the teen is troubled is, first, again, has there been a change in their school performance? Is there any marked change? And this could be up or down in terms of sleep and appetite or weight. Has it fluctuated in terms of it's now increased or decreased, either one of them? Have they changed in terms of their pattern of spending time with friends or family? Are they spending more time just alone in their room, isolating? Have they changed the group of friends dramatically? Those kinds of things give you some indication that something might be going on. Is there do they tend to express or sense any sort of feelings of hopelessness, worthlessness, or just almost describe feeling numb and tell you that they're empty or that nothing's going on? Do they not engage in some of the activities that they used to enjoy? Did they quit any sort of teams or activities that they used to do? Also, on from the standpoint of like looking at ADHD and possibly a mood disorder like bipolar, is there any sort of restlessness, that they can't sit still, that they're not sleeping, that they're staying up all night, those types of things, problems concentrating, that they can't remember things, they seem forgetful, distracted, impulsive, constant kind of complaints, aches, pains, from one area to another, constant stomach issues, maybe a lot of just vomiting, diarrhea that's not necessarily from an eating disorder, but just no clear cause for stomach distress, and it's not the flu. So those would be some of the things that you would watch out for.
Got it. And we've gotten this one, not just on this forum, but as well called in. You have a teenager and they realize that their loved one, their son or daughter, exhibiting some of these signs, and they are at a loss, and they say, what would be my first step for seeking this kind of help for my son or daughter? Should I start a conversation with my pediatrician?
I thought that was interesting. And so certainly I think that a lot of times we do get referrals that come from the pediatrician. I think that has to do with the parent and the child's comfort level. If the child and the parent have a good relationship with the pediatrician, some pediatricians are far more adept in managing and screening for mental health conditions than others. And so I think that's a great place to start if that's something that is at the comfort level for the parents. If the parent already has some connection with a mental health practice, if the parent, him or herself, already has some involvement, then certainly they could reach out and find out, who might be a person that could see their child. One of the biggest things or problems, limitations we have in this area in Tidewater is that we don't have enough individuals that see or treat young children. It's pretty much under the age of 15, it's difficult to find people. So I think one of the reasons that you say, who do we go to first? Do we reach out to the pediatrician, is in part because you might be struggling for a little bit to find somebody who, particularly with a young child, who you're going to have assess them. I think the other thing that's important when you're talking children is that getting some testing, before you jump the gun and try and figure out, certainly if there's trying to determine what course of treatment to go, it's helpful to have some psychological testing to really understand what is going on. Is there a situation of a learning disability that might be generating anxiety? Is there an underlying anxiety versus a depression versus some other type of situation?
Okay, excellent. We're going to transition just a little bit in regards to some of these strategies for seeking help, either for yourself or for others. And one of the things is how do you how do you have the discussion about the importance of treatment? And I think that this question might have been the import from a parent. How do you express that and have that conversation with a child? But as well, we've come under, there are certain situations where it is the young adult that has that issue having the conversation with the parent. So could you talk a little bit about how do they how does a, a parent discuss that with their young adult?
So how does the parent approach the teenager about trying to seek treatment?
Or the teenager, the teenage female or the 22-year-old male, after they are first they have their first break, or they have initially gotten a psychiatric diagnosis, and their child is not, you know, they're not on board with the treatment, and that the importance of that. What are some of the things that a parent can do and say to try to highlight that if they don't have, let's say, a really collaborative practitioner like you are in that shared decision making? Parents are left, what do I do? You know?
Yeah. So, I think first you want to really be cautious about the way you approach, because obviously, it depends on when you do it, where you do it, how you do it, of how it's going to be received. And that's probably first and foremost, because if it's not at a moment that, if it's done at the wrong time or place, then I think you've already gotten a situation where you're going to be shot down. So being aware that just because you have it on your mind and it's concerning, that it needs to be at a moment when the individual may be more receptive. So it may not be the moment that the person is walking out of the hospital from discharge, of honing it in that you've got to make sure that you stay on your meds, but rather finding that there's another point in time when that individual seems to be receptive and open to having a conversation. So I think it's important to sense out moments or opportunities when an individual seems to be inviting or wanting to have a conversation about his or her mental health, and then asking more questions rather than giving more answers. Asking the person, how he or she is feeling and how the medication or the treatment is doing, what was their experience, so that first you can get a sense of how the individual feels like things went. And then if it's all bad and I don't ever want treatment again, and this is what was wrong and that's what's wrong, I think then the approach is from there is you can point out observations of how you think the individual has improved, or what you think is going right, and allowing that the person to then make an observation or a counter as to whether he or she sees that as well. And it's kind of building blocks from there. I don't know if that seems too obtuse, but so I think that's important, is first of all, like how your approach is. And then second of all, if in fact somebody is unhappy with a particular approach, it's suggesting to them, offering to help them to get a second opinion, or kind of using your own relationship with them to bargain. I think sometimes I talk a lot of times with parents who throw up their hands, who feel like, well, I can't get him or her to take medication or to do anything. And I'm thinking, okay, we've got an adult here who's living, an adult child with mental illness who's living here with you, who you're paying rent, you're giving them food, you're doing this and that. And so there's some amount of bargaining you can do with that individual to say, okay, I'm willing to work with you to do X, Y, and Z, and I need you to tell me what you're going to do to take care of yourself, and that we can work together on that. And so I think that would be the other place, Courtney, is that talking about the fact that you're recognizing how much you want to help the person, but you need them to also help themselves.
Thank you for that, Jenny. The next question, how would you address a parent that you think is suffering from depression or from another mental illness, but how is you as let's say an adult child address that with a parent and approach that?
So I think it's important to plan ahead of time before you're going to have that conversation, as to that you've got some very concrete examples. If you feel that you're concerned, then what have been your specific observations or evidence? Is it that you've noticed that mom or dad has lost some weight, or that they're not taking care of themselves from a standpoint hygiene-wise as they used to, or they're not getting involved in these particular activities? I mean, you need to have specific examples in terms of their mood or behavior. Or if, the other would be, I think the more common example, rather than somebody needing to address the parent about depression, would be, addressing a parent about dementia. And a lot of times, that's a difficult conversation when you feel like parent has been showing some pretty consistent signs of cognitive decline, not being able to keep track of things, but is kind of in denial of it. And so being able to identify clear evidence, then showing support and concern, asking about their feelings that they're having in terms of not being able to do X, Y, or Z as well. And what are their concerns, what do they fear about seeking help? What do they know about getting help? Again, more questions than being direct and saying, this is what we're going to do, but rather telling the person you're willing to support them. You want to know what they would like to do and how you all can get there together.
I like that whole question piece as opposed to the telling on there. And this is again, as approaching, if you are a teenager, a young adult, and you're approaching your parent because you feel that you do need therapy, you do need some, but you don't want to go into all the details of what you're going through, what would be a good way to do that?
I thought that was an interesting one. I do think I've seen that before, where there are times where individuals feel that they, as a younger generation, may feel more ready and open to accept mental health services, and may be fighting that there is more stigma in a older population, with their parents, may feel a little more uncomfortable about the idea of seeking that sort of help. And so I think the first thing is making sure that you identify what is the feeling, or not so much the specifics of the issue, but identify what is going on wrong in terms of a stress or a sadness and how it's affecting you. Is it affecting your day-to-day functioning, school or work, or your health? Is it affecting your desire to engage with others, so that first and foremost, they understand that you are having a emotional problem that is having an impact on your function. Because whether or not they believe in seeking in getting help, hopefully if it's a parent, they love you enough, they don't want to see you suffering in that way. And then the second component would be to really and letting them know how long that's been going on, the duration, and that you feel powerless or have tried things and are not getting somewhere with it, which is how you've identified that this is what you want to do about it, help seeking. But then I think it's a matter of doing your research as to having already identified where you want to go or what you want to do, so that you have a plan. And I think when individuals kind of already look like they are sure of themselves about what they want to do, then that can give a little more certainty for individuals who have some uncertainty or residual stigma about seeking mental health services.
So you don't have to be really specific, except you do have to be specific about that back end. And that makes a lot of sense. As a parent, as a friend, as a loved one, what are some of the best ways to support someone living with depression, anxiety, or another mental illness? What does that look like? Is in this support, not the money, not here's a house, but what does that look like to give that person?
I mean, I think one of the things you think about with individuals who have any sort of mental health problems is struggling with a sense of identity and self-worth and confidence. So the more that we can provide those affirmations, identifying the strengths, the things that he or she are doing well, and helping that person to know that you believe in them and are observing the progress, the things that are going well. It also models for that person to focus on the things that are good rather than reverting to the things that aren't working. I think that's one critical component. The other would be periodically checking in and saying, what do you need that's going to support you on this journey? How can, and with that, I mean, it certainly depends on the individual, because there are some who are going to say, well, I need money, or I need this, and you want to do that with also having clear boundaries. And if you are providing certain supports that you feel like are pushing on enabling, then giving clear, consistent, and firm deadlines. So I think that that does not hurt the individual to know that, okay, I'm providing you this support, and I will continue providing you this support until this period of time. We're working together to get you more independent. And how do we move along that track?
I love that you started that off with focus in on what they're doing well and that positive piece, because I think we all have a tendency sometimes to, maybe even as parents, to focus in on, but there still is this piece, and that would be definitely the wrong approach. So thank you for that on there. And I think we answered the next question. Here was a good one.
I would just go also, like, going back with the teens, like there are a number of and I don't know who, but there's some really good, I give a lot of like websites or things for people to try. But with the teens, there are so many different, we didn't keep that one, but there's so many resources now for teens to look at themselves. And I think one of the things, and aside from, seeking out through the pediatrician or whomever, I would encourage if you feel like your teen, you see some concerns in your teen, I would encourage the teen to actually utilize some of the online support so that he or she can get some questions answered for themselves. Because like I said before, that when they're in that kind of developmental stage, it's hard for them to necessarily ask the questions. They don't even know what questions they want to ask or what's going on with their body. And so there's a lot of resources through the adolescent health org, and then there's young men's health and young women's health, and within those there's some emotional health components and assessments, and they can kind of get their own answers, and it's geared for that age group. And then there's an organization called mindup.org that was originally designed for schools, but because of COVID, they changed over, and now there's it's free, and it's really geared also towards parents and helping kids to be able to self-regulate using some mindfulness practices at home. And, although it was geared originally kind of for elementary kids, I'll say it's stuff we can use as adults. I certainly listened to some of it and like it myself. So I really do think that is a good resource as well.
Oh, that's excellent. Mind up. That's terrific. Yeah. So you're in your early 20s, let's just say, in a new relationship, and that could be with a significant other, that could, you have a boyfriend or girlfriend, coworkers, your friends. What point do you share that you're living with the mental illness, and how do you share that?
Yeah. So I thought that was an interesting one. So I certainly think that in terms of sharing, that needs to always be when you feel comfortable, at a point, or ideally it would be more at a time when you're feeling stable versus a time when you're feeling like you're needing to reach out in crisis. I mean, in crisis, I think it's the better time to rely upon those individuals who have been your anchors, whether it's your provider, your therapist, your family members. So I would say when you are newly introducing an individual that you're in a relationship with, it would be when you're stable, when you feel ready, and that the amount of disclosure always just needs to be what's comfortable to you. There's no reason that you have to be an open book and give all and everything. And of that information, of being mindful that you want to also identify what about the experience has made you a stronger, better person. That it's not all bad, that you can reflect from it and see how it puts putting a positive spin on it, and how this person can also look up to you as how it makes you even more desirable.
Excellent. Because we are we've got about 10 more minutes left on this front. We did have some questions that is hopefully maybe if you'd like to touch on. And one is, obviously we've used the word stigma for decades and decades, and it still exists. It doesn't exist for some other illnesses that used to have stigma attached to it, like cancer, even leukemia. I mean, there are a bunch of them. But with mental illness, we can't stop using the word, and we can't stop having these barriers put in place in behavioral health. And we would love to get some of your thoughts on that of, hey, why, gosh darn it, and then what are some of the things you could share that need to happen?
Well, I mean, even as of today, I had a conversation with one of my clients in terms of, that, and regularly we talk about the fact that if your cardiologist said to you, okay, your blood pressure is elevated and you need to take this particular medication, then guess what? Half the time they don't even question or ask what the medication is, how much they got to take. It's they walk out of there, they start taking it, bada bing, And I'm not saying that that's the right answer either. I wish there were more questions and what are my options and whether I should be on this one or that one and what are the potential side effects, and that they would weigh those options as well. However, in our area, it is always as the stigma component of it is, first of all, even if they're going to be seeking mental health treatment, because too many people think, oh well, if it's a mental health problem you should be able to control it, and if you can't control it, then obviously there's something wrong with you right there, that you are weak. And then the second component of it is, okay, so if you start seeing a counselor, then maybe it's okay. And as long as you all can figure out some things, then it's going to get better. But now if you need medication for it, then you're really weak. And so it's like there's levels that we have to peel of the onion to get down to it. And so then it comes that maybe people will say, all right, well, I need medication for a while. But number one, if I'm going to have to be on more than one medication, then I'm really failing. Or if I'm going to have to stay on this medication after it seems like I got better after a month, so I go off the medicine. So there's many different components of this, of if we're looking at and realizing that our brain, which seems to be, would it not be the most important or powerful organ in our body? So therefore, it should be the one that we would say, if there's something broken and not working there, I need that as much, if not more. All of our organs we need, but some of them, we know we can lose one kidney and we're still going to be okay. We can lose a gallbladder. There's different things that we could possibly go without that some people absolutely wouldn't lose. But we can't lose our brain, and we need our brain to be working all the time. So I think it's pretty important to speak to that, and sometimes people are more willing to get it. So that's, I guess, one way that I talk to people about it. I think that we have to do a better job, both within mental health and then folks that are seeking mental health treatment, whether it's for a short period of time, whether it's ongoing, need to not feel ashamed or embarrassed about it, that it should be like any other condition, and to not be secretive. The more that we do have folks that are celebrities or singers or different people that are coming out and talking about their experiences, I think that has really helped to some degree in shedding some of the shame or the the feeling that people who are bright, talented, smart aren't going to have these problems. And it's like, no, you can still be successful, bright, talented, and smart, and have depression, have bipolar.
That's so very true. That's so very true. And because coming up and finalizing this, I wanted to find out if you had anything that you wanted to share with the group. As everyone knows, this is being recorded, so you can share with anyone that they can reference this or see it for the first time. But is there anything you would like to share with the group here as it pertains to maybe a question you've heard that people have been embarrassed to ask, or just something in general about mental health, and what you would like to see happen.
Uh, I guess, the one thing I would say, I think I appreciate all the individuals that have come out to listen tonight, because I certainly think that that doing things like this, of educating, of sharing information back and forth, is critical to us continuing. I mean, it seems like a lot of the folks that are on this actually already have some involvement and knowledge in mental health, in education, in different areas where they're working with people who either, whether it's a family member or whether it's in their field. And so I think that in and of itself is how we're going to make more of a difference across the community. I think there was the last question that was out there is, how do we advocate more? How do we get news media involved? How do we make more of a presence? And, I don't really have an answer to that. I just think that the more that we, as a group, continue to share information and offer to one another, support, that would be the most benefit. Certainly, COVID has not made it easy on our mentally ill. They are more vulnerable to being sicker, those with severe mental illness. So as well as just our general population, there's a higher rate of mental illness. So
No, agreed. And I think the more we talk, the better things get. And we got a phone call today that hopefully is going to garner a lot of this media coverage that we want. And it was just from an N of one person who has an extraordinary platform in the media, who said, we want to do a series, we want to do commercials, and they want to do it, not do you want to pay for it. And so these are like the little gifts, but this is conversations, talk about grassroots, they build, and this is what we can do. And we can have people and true experts and true community partners like Jenny Brown come and share and answer questions. So I appreciate everyone very much. And Jenny, thank you from the bottom of our hearts. You've been extraordinary. And no, it's going to be taped. And so spread the word. All right. Because we do have a lot of people that come to our library to watch past programs. So thank you, everyone. And want you guys to enjoy the rest of your evening.
thank you.
Good night.
Bye.